ننتقل الحين حق الفقرة الثالثة والأخيرة من محاضرتنا اليوم مع دكتورة فجر بوكبر، وحديث عن الاحتراق الوظيفي أو البيرن اوت يحاورها الزميل عبد العزيز الخالدي. يعطيكم العافية.
يعطيك العافية دكتورة فجر وحياك الله، وسعيدين بانضمامك هنا معنا، وهذه المحاضرة اللي لها أهمية كبيرة، الاحتراق الوظيفي والدراسي أو البيرن اوت بشكل عام. مثل ما يقولون راح أسلم المايك والكاميرا لك. تفضلي دكتورة.
السلام عليكم. بس الفيديو is not working yet.
دكتورة لو معلش أمر ترفعين إيدك.
اوكي ان شاء الله.
تمام دكتورة؟
Yes. Just a second. I don't think it's working. Oh, it's working. Okay. Can everyone hear me?
نسمعك دكتورة.
Okay. Hello everyone. Thank you so much, Dr. Ibrahim and Dr. Bassam, for the very interesting talk. Of course, Dr. Ibrahim is the star of the Kuwaiti board, as you can all see. We can all learn something from him, so it was a very interesting talk, inshallah. Before I start my presentation, obviously we're going to talk about burnout today. Before I start talking about the lecture, I would love to take a minute or two to thank you guys for inviting us and speaking in this conference, and to also thank you for all the effort and the steps that you are taking to try to raise awareness about mental health. As you all know, it's a very important topic and that is not being discussed a lot. I'm going to share my slides now. So the video might stop because I'm using the iPad. So if you can just... Can you see the slides?
نعم.
Okay. So burnout, obviously you have heard this term before, especially in the last 2 years with COVID and all. So today we're going to be able to talk, inshallah, about more details regarding burnout, what burnout actually is, how can we detect burnout, and how can we prevent it, and if that happens, how are we able to treat it and intervene in order to reduce the burnout that has happened. Before I start the presentation, I would like to start with, so these are the objectives. Hopefully we're going to go through all of them during this lecture. I'm not going to take a long time. I know it's the last lecture, so you're probably exhausted, but I will be quick, inshallah. So before I start the actual presentation, I would love to start the lecture with a clinical scenario. This clinical scenario, obviously it is fictional. However, you will see it a lot in the hospital, especially inshallah once you graduate and you start working. You might even notice these things in the clinical scenario within yourself. You might notice it among colleagues during medical school. So it's a very common clinical scenario that we see in everyday life. So I thought I should introduce it at the beginning of the presentation. So in this, the hero of the clinical scenario is Dr. Maryam. So let us meet Dr. Maryam. Dr. Maryam is an intern doctor. She recently graduated from medical school. She is working in COVID wards. Dr. Maryam is known to be a very hardworking, enthusiastic young doctor. She always takes the excess shifts at the hospital and cares for her patients. Unfortunately, in the past couple of months, Dr. Maryam started feeling some changes. Sorry, there are constructions going around, so this is the most quiet room that I could find. So Dr. Maryam, recently she started feeling overwhelmed, she started feeling exhausted, she's always drained, she feels like no matter what she does, she's unable to catch up with work and other responsibilities. Dr. Maryam started despising going to work. She started hating treating and seeing patients, even though being a medical doctor is all what she wanted to do since she was 5 years old. So Dr. Mariam eventually is now contemplating about quitting her job. What Dr. Mariam is experiencing is, unfortunately, burnout. So burnout in physician, obviously burnout is a very broad term that can happen in any field. It doesn't have to be in the medical field by itself. But burnout is especially important in the medical field because it has a lot of, it affects a lot of physicians, and it has a very high prevalence among the medical field. So burnout begins usually during medical school. It continues throughout residency and during practice. The prevalence of burnout is very high among medical students. It ranges between 31 to 49.6% of medical students. So that's almost half of the medical students. Whereas in residency, it can rise up to 90%. And then while the national physician burnout rate is more than 54% of all physicians. So what is burnout? Again, we hear this term a lot. So what exactly we mean by burnout? It's a state of emotional, physical, and mental exhaustion. It is usually caused by excessive stress that is usually created by the workspace. It can lead to loss of motivation, loss of interest, just like Dr. Mariam. Even though she always wanted to be a medical doctor, she always loved treating patients, she's now contemplating quitting her job. So it can lead to fatigue, and eventually you may feel like there's nothing more of you can give. So burnout is a very serious thing. The WHO and the American Psychiatric Association defines burnout as a syndrome of 3 different domains. The first domain being the emotional exhaustion, depersonalization, and low sense of personal accomplishments. We're going to talk about each one and explain them in a bit when we're talking about the signs and symptoms and the way we're detecting burnout. It's worth noticing at this point that burnout is not a medical diagnosis, and it's not a mental diagnosis either. So if you open any textbook, including the DSM-5, you will not find burnout as a medical diagnosis. Why is it important though? So why do we need to know about burnout even though it's not a medical diagnosis or mental disorder? We need to know about burnout because even though they're not diseases, they're not diagnoses yet of disease, it can lead, however, to severe mental and medical issues that we're going to talk about later on in this presentation. Okay, so how can you detect burnout? You might feel that you may be experiencing burnout, but you're not 100% sure. You might feel that a colleague of yours may be feeling drained and may be experiencing burnout, but you're not 100% sure what burnout actually is. So signs and symptoms of burnout includes the 3 domains that I mentioned in the definition. Okay, so the first thing is the emotional exhaustion. The patient or the physician might feel emotionally exhausted, meaning he may feel drained. He may feel like he doesn't have any energy. He's tired of going to work. He lost the enthusiasm. He lost interest of his job. He feels helpless and hopeless and defeated. Another symptoms of burnout is depersonalization. So the physician might actually, we see this a lot in the hospital actually. We might have run into doctors where they treat patients as diagnoses only and not actual human beings with signs and symptoms of the disease. So this may happen because of the depersonalization that comes with burnout. So the physician might feel detached, disengaged from work, from patients. They might isolate themselves. They get cynical. They get very pessimistic about their job, about their colleagues. They get very angry, they get into fights, they get into trouble with other people at work, and they get less empathetic towards patients, which can be a very dangerous thing because it can interfere with the patient's care. Another thing, or another domain that is involved in burnout is the poor performance. So because you are drained all the time, because you don't have energy, you're always fatigued, this might affect your performance at your job, obviously. You will feel unable to concentrate, You may go into doubting yourself. You feel like you're inadequate. Some people would say like being a medical doctor is a very serious thing. It's a very important job that I cannot do anymore. Other symptoms of burnout might include headaches, insomnia, tension, being angry, throwing anger tantrum, impaired memory and decreased attention, and obviously thoughts about quitting your job. Okay. So how can we go back to our question? How can we detect burnout? There are two ways of detecting burnout. First, by taking a history from the patient, which is the case with all the with every condition we have to take a good history and to ask about the signs and symptoms, which I just mentioned. Another thing that is more of an objective method of detecting burnout is the Maslach burnout inventory. I hope I'm pronouncing it right. Maslach burnout inventory is basically a questionnaire that is developed to detect and measure burnout. It includes around 22 items that measures the 3 domains that I mentioned in the definition of burnout in the previous slides. The Maslach burnout inventory is considered the gold standard for identifying and detecting burnout. So if you read more about burnout throughout journals and articles, you might run into this name a lot. So you have to know this is like a gold standard that they use a lot during research, and they base their studies on it. Okay. So why burnout so serious? Why are we taking a whole lecture in this conference talking about burnout? Not only because burnout affects physicians the prevalence of burnout in physicians is very high. As I mentioned earlier, it can affect up to 50% of physicians. But burnout is especially serious and especially important in the medical field because not only it affects the physician himself who is experiencing burnout, but also it affects the patient that they're treating and also the organization or the hospital they're working on. So what impact does burnout has on the physician? Burnout can have a physical effect or physical impact on physician. Studies have shown that burnout can increase the risk of developing hypercholesteremia, type 2 diabetes, coronary heart disease, and other medical conditions. Another thing that can be impacted or affected by burnout is the psychological aspect of the physician. So they found out, research have found that burnout can lead to insomnia, depression, substance use, and suicide. There are a lot of studies, just a side note, there are a lot of studies that examine the association between physician burnout and depression, as well as other mental disorders, including suicide. Physicians, including suicide, okay? So as you can all see that during COVID, we heard a lot about physicians committing suicide due to burnout, due to depression, and due to the stress that the COVID-19 has had on these physicians. So physicians in general have a suicide rate of 2.5 higher than the rate of the general public. And on average, a study showed that 400 of the US physicians die by suicide each year. And most of these suicides are committed because of depression and burnout. Okay. Another thing that the burnout will impact if it affects the physician himself is the patient. So because the physician will be burned out, he will be impaired in judgment, he will be drained all the time, he will not be able to think clearly, so he will not be able to deliver the proper quality of care. So that's when medical error starts to increase. Because of the medical error, that happens due to the burnout of the physician, it can impact not only the patients, but also the organization or the hospital. Okay. Physician, another thing that affects the organization or the hospital due to the burnout of the physician is because, like what happened in Dr. Mariam, she's thinking about quitting. So if Dr. Mariam quits, the job will be relocated to other physicians, making them again more stressed and leading to more burnout for the other physicians. Okay, so what makes someone vulnerable to burnout? We know that the cause of the burnout is the excessive stress created by the workspace. But what are the risk factors that make you more vulnerable to burnout than any other person, especially in the medical field? First is the excessive stress. So we all know that medical field, including working as a medical doctor in the hospital, is it's a demanding job. It requires a lot of dedication. It requires a lot of commitment. But when this stress is exacerbated with long hours, plus very long shifts, more than 24 hours shifts, more than 80 hours of work per week, when you're working with a senior doctor who is not appreciating you, for example, who is being mean to you all the time, criticizing you, all of these things will increase the stress of the already stressed out field, or the already stressful field, so it will lead to burnout. Another risk factor for burnout is when people have problems with balancing between their work and their private life. So they will not have time for the personal or family life. And we see that a lot when people go to work and thinking about their private life, and then when they leave from work, they go home thinking about the cases that they have seen in the hospital. Sleep deprivation obviously can lead to higher risk for burnout. Being emotionally drained from dealing with sickness, death, and pain all the time can increase your risk for burnout. Financial strains. As you know, not a lot of people are lucky enough, like us, to have free medical education. A lot of medical schools are very expensive, meaning students already have a lot of student loans and a lot of debts. So these can all increase the risk for stress and burnout. Being a perfectionist, so it's part of your personality to want everything to go smoothly and be 100% perfect in everything. This can lead to burnout as well. And having low self-esteem and need for approval from other people, as well as, this is very interesting point for me to know that being at a younger age and early in your career increases your risk for burnout. So there are a lot of studies that showed burnout is the highest during your intern year, which is the trainee year, and the first year of residency, rather than later in your career. Okay, so burnout and COVID-19. Obviously, COVID-19 has put a lot of stress on healthcare workers. As I mentioned, medical field and being a medical doctor already is stressful enough. But to actually work during a pandemic, it's a lot of stress that is being put on the healthcare workers. So a lot of studies have, a lot of research have studied the relationship between burnout and COVID-19 among healthcare workers. I will mention only two studies. One study that has been done in the US, it concluded that around 49% of the healthcare workers experienced burnout because of due to the pandemic. Another study done in Ontario, Canada, they found out that healthcare professionals, especially working in intensive care settings and emergency departments, have had elevated risk of burnout compared to other hospital healthcare workers. And again, they found out that nurses and younger healthcare professionals or trainees have been at greater risk of burnout during the COVID-19. Okay, so what are the protective factors? How can I protect myself from being burnt out? Something called resilience. So being resilient or having a higher level of resilience lower your risk of burnout. What do we mean by resilience? It's basically being able to adapt under pressure. So we hear a lot of people who say that we work better under stress or we adapt well under pressure, and a lot of people who don't. So this is what we mean by resilience. So being resilient is able to adapt under pressure and being able to work even if you're in a stressful environment. Okay, so how can we build our resilience? We can build our resilience by a lot of things, but the most important thing is to take care of ourselves, to exercise, sleep well, take good care of our nutrition, to have good social support, whether it's in the work, whether it's a professional good social support or it's private social support. To take some time away from work, and finally to practice mindfulness. Okay, what are the interventions if in case we have burnout? What can we do? The interventions that decreases or reduces or target burnout is characterized into three things. First, it's an individual focused intervention, organization focused intervention, and combined between the two. And the most important thing you have to know that combination between individual focused intervention and organization focused intervention is better than just individual focused intervention, as it can provide better effects in reducing burnout as well as more long-lasting effects. Okay. So, talking about the individual focused intervention. The individual focused intervention includes stress management therapy. So if I feel burned out, I might go do something called the cognitive behavioral therapy, which I'm sure Dr. Ibrahim talked about, and Dr. Bassam as well. I can do something called mindfulness, which they also talked about. And mindfulness, just in case anyone didn't know what mindfulness is basically being aware of the present moment. Okay. And mindfulness has a lot of research in reducing stress and reducing anxiety. And we all said the only cause or the main cause of burnout is stress. So if we reduce stress, we can reduce burnout. Another thing you can do is exercise, which is a very obvious thing, but you can also exercise. Only 10 minutes is very efficient and very helpful in reducing anxiety and then reducing burnout. Other things like adaptive skill training and workshops that can increase your resilience, and communication skills training that can help with reducing burnout. With regards to organization-based intervention, there are a lot of things in terms of what the organization can help to reduce burnout. I only mentioned a few of them here. So the first and foremost, the most important thing is for the organization itself to talk about and raise awareness about important topics that physicians might go through, like burnout, depression, suicide, etc. And to have a reflection time. Reflection time means that we have a group meeting explaining to the physicians what responsibilities they should do, what are the things that they are required to do, and what are the policies for taking days off and holidays, and to tell them about the flexibility of the work schedules. And to build a community. To build a community meaning the department itself, for example, if you are with the medical department or the psychiatric department, the department itself tries to build a community, to build a social support or professional support for all the junior doctors as well as the senior doctors by doing social events, by doing activities that they can engage in social support. And also to ensure access to care. So the organization should be able to let the physicians know in case of an emergency who they should call, who should they go to, and what should they do. And this has actually been implemented in KIMS for the Kuwaiti board. I'm not trying to advocate for Kuwaiti board, but it's actually been implemented in the Kuwaiti board website. You can find, there is a place where you can ask for help, whether it's for a mental health issue or anything like burnout or anything you would like, and they can refer you to a mental health specialist to provide the help that you need. Another thing the organization can do to prevent or to reduce burnout is to improve the workplace environment. It doesn't make sense that the patient or the physician who is burned out to all the cognitive behavioral therapy, to the stress management workshop, and exercise, and do all of these things, and then come back to the same toxic environment, that the burnout actually happens. So if he came back to the same environment, obviously he will have burnout again. So the best thing to be done is to improve the workspace or the workplace environment by changing rules, by being more flexible with work schedule, by limiting shift hours, by limiting working hours for the physicians, and to shorten their rotations if it's needed. Last thing that the organization-focused intervention is increasing participation of decision-making. This is very important in terms of junior doctors. As junior doctors, a lot of them, studies have shown that a lot of them experience burnout because they're only being left to do the paperwork. They're not actually involved in the treatment plan or the decision-making of the management of the patient. So they're not exactly practicing medicine, the thing that they're there for. So in order to tackle this issue, we have to increase the participation of the decision-making and of these junior doctors. So last but not least, a couple of days ago, I asked you guys to fill in a survey. It's a very short survey in Google form, trying to ask you some of the signs and symptoms of burnout. The goal of the survey wasn't exactly to diagnose you with anything. The goal of the survey was just to make you see the importance of burnout and how even like among us, without even knowing, we might be experiencing some signs and symptoms of burnout and we don't even know it. So around 77 medical students and doctors participated in the survey. So I would love to thank you for the help. Around 87% of those, of the 77 medical students, 10.4 were healthcare providers, and 2.6% of those were dental students. The questions that I've asked is, first, do you feel like your work or school is tiring, difficult, or demanding? Around 46.8% of you answered as always, and 45.5% answered as most of the time. So that's a huge percentage, almost 90%. They said most of the time, or at least always, they're thinking that their work or school is very tiring, difficult, and demanding. Your answers to, do you feel your work, school performance is suffering lately? Again, 24.7% answered as always, and 32.5% answered as most of the time. Do you feel disengaged from your patient and yourself during work or school, like seeing your patient as nothing more than diagnosis? Thank God, not a lot of you answered as always for this question. Only 18.2% answered as most of the time, and 50.6% answered sometimes. And the question, your answers to the question, do you feel like you no longer enjoy going to work or school? 15.6% answered as always, and 31.2% answered as most of the time. And for the last questions in the survey, do you feel drained and exhausted at the end of the working or school day? Around 49.4%, so almost half of you answered as always, which is a huge percentage. So again, the goal of the survey was not to diagnose you. This is not a validated survey. As I mentioned, the validated survey is the Maslach inventory burnouts, but unfortunately, this survey has copyright, so we cannot distribute it. So I tried to make the survey about some of the signs and symptoms that may indicate you might be having burnout. And unfortunately, a lot of you scored a very high score in the survey. The take-home message from this presentation is to take care of yourself. You cannot provide care to a patient if you are not well in the first place. If you are burned out, you need to take some time to take care of yourself. You may take a vacation, take a break, practice mindfulness, do whatever you want to be able to get back on your feet and continue working in a proper, good mindset and mental well-being. So there is a quote or a saying from a doctor. He's Dr. Jack Cornfield. I really like this quotation. I keep reminding myself with this quotation every time I feel burned out or I feel stressed out. If your compassion does not include yourself, it is incomplete. So if you're not empathetic with yourself, you cannot be empathetic with your patients. So these are my references. Most of them are from journals and the American Psychiatric Association. You can feel free to read more about burnout and educate yourself in this matter, and protect yourself from burnout. Any question?
يعطيك العافية دكتورة فجر على المحاضرة الثيرة والنيرة يعني في موضوع البيرن اوت. وإذا أحد عنده سؤال يتفضل.
أنا عندي سؤال، بس عبد الله رفع إيده قبلي، خليه يتفضل.
يعطيك العافية دكتورة فجر، بس في شغلة لاحظتها مثلا بعدد كبير من الطلبة، خصوصا طلبة التخصصات الطبية، وهم متعودين أو كنا متعودين أن نكون الأوائل أو أصحاب درجات عالية في الثانوية. فالتغيير اللي يصير هني أول ما تدش الجامعة، أن أنت يوم كنت تكون الأول أو من التوب 10 بالثانوي ما راح تصير هني نفس الشيء. فهذا هل من أسباب البيرن اوت التغيير هذا أو الصدمة هذه، هل تسبب بيرن اوت عند الطلبة؟
طبعا لان شنو، احنا عندنا all medical students that have this in common. We have some level of anxiety. We have some level of always wanting to be perfect, and then to be perfect in everything. We have this perfectionism, and being in this mindset can lead to burnout because you're stressing yourself out, and then you're taking too much that you can handle. So this can lead to burnout, obviously.
شكرا دكتورة.
Any other questions?
يعطيك العافية دكتورة فجر. هو صراحة سؤالين، يعني السؤال الأول هو مجرد فضول، شنو أكثر الوظائف، يعني أصحاب الوظائف اللي تشوفون عندهم بيرن اوت غير أصحاب التخصصات الطبية، يعني اكسكلودينج الدكاترة الفارماسيست إلى آخره، شنو تخصص ثاني كومن ان انتم تشوفون عندهم بيرن اوت؟ هذا السؤال الاول. السؤال الثاني، هل في دور ممكن جهات العمل تقوم فيه بحيث ان تحمي موظفينها من البيرن اوت؟ مثلا اعطيك مثال وغيسي انت على اجابتك. مثلا تخفيف ساعات العمل، او مثلا ما تحكر الموظف بشفت معين، مثلا نايت شيفت، يكون في سويتشنج.
اوكي سو بالنسبه حق الدور اللي تسويه جهه العمل زين عشان تقلل البيرن اوت، نفس ما قلت اللي هو الاورجنايزيشن بيست انترفنشن. طبعا اتس نوت بين دون زين with جهات عمل وايد زين، مو كل جهات العمل زين they actually have يعني some form of يعني awareness about burnout. زين they don't know exactly what burnout is يعني except for the medical field we have an idea. We are trying to implement some of these interventions. بس ممكن في جهات العمل زين عندهم هذه الايديا وعندهم هذا الاويرنس. لكن الاشياء اللي ممكن يسوونها جهات العمل عشان يقللون البيرن اوت definitely like what you mentioned زين they especially in the medical field زين they might زين يعني مثلا في بعض التخصصات تخلي الدكاتره يداومون اكثر من 24 ساعه، يداومون اكثر من 80 ساعه بالاسبوع، وهذا يعني مهنيا واخلاقيا المفروض انه ما يصير. زين فدور هني جهه العمل انها تحاول تقلل اللي هو اوقات الشفتات، تكون فلكسبل بالورك زي سكجول. اذا كان الشخص عنده مثلا major life events he cannot attend اوكي زين نحطه باليوم الثاني. نفس الشيء زين اذا ما كنا نقدر مثلا نايت شيفت نحطه بالمورنينج شيفت. هذا المفروض اللي يصير حاليا بالكويت. زين في شيفت زين toward this attitude. قبل كان لا يعني اتس فيكس اتس ريجيد زين نظام الاولد سكول انه خلاص انا مثل ما انا داومت 24 ساعه انت لازم تداوم 24 ساعه. doesn't matter doesn't care about the burnout and all the effects that can follow the burnout. لكن زين الحين there is a more awareness towards the topic itself, so they're trying to implement these يعني techniques. Also another thing that جهة العمل ممكن تسويه هو organization تحاول ان تقول حق مثلا الموظفينها ان شنو الاشياء if you feel if you feel in a burnout or you feel depressed or you feel anxious or you need help in any sort, where you can go, what are the resources that you can get. And also this has been implemented بالكويت نفس ما قلت لكم اللي هو بالكويتي بورد مو بس بالسايكايتري، كويتي بورد in general بالويب سايت مالهم ان it's mentioned for every resident that they can access to these mental health resources at any time they want. Okay. Sorry, the first question I forgot that.
اللي هو شنو أكثر مهنة تشوفون عندهم احتراق وظيفي غير مهنة الطب أو التخصصات الطبية؟
That's a very interesting question. Honestly, I don't know anything about that. And then the thing that I know التخصصات الطبية اللي أكثر شيء فيها احتراق وظيفي هم تخصصات مثل الكريتيكال كير، الاستيزيا، الانتنسيف، الامرجنسي، هذول التخصصات اللي يكون فيها أكثر احتراق وظيفي. Plus the nurses are very prone to burnout. Obviously, with all the responsibilities that has been thrown to the nursing staff.
زين دكتورة معليش أمر بعد سؤال بسيط.
تفضل.
شنو بوجهة نظرك شنو اللي فتح عيون جهات العمل على أن دير بالكم ترى هذا مو بس مضغوط، لا هذا قاعد يمر بمرحلة احتراق وظيفي وهذا شيء سيريس يعني قبل العادي. يعني مثلا حتى احنا كأشخاص والله تعبنا من الشغل اخذ إجازة وسافر، الحين لا، حتى لو تاخذ إجازة وتسافر وترد تشتغل للحين أنت تحس بالاحتراق الوظيفي لأن خلاص هذا شيء مسك فيك ما راح يهدك ممكن.
بالضبط. إنزين ومثل ما أنا قلت لك هو الاحتراق الوظيفي إنزين علاجه الناحيتين. إنزين الناحية اللي هو الانديفيدوال إن أنا مثلا I take a break إن أنا أروح مثلا workshops whatever. إنزين والشيء الثاني أو الجزء الثاني من العلاج اللي هو جهة العمل. ماكو فايدة أنا أروح أستانس و I unblock بعدين أرجع على نفس الجهة العمل اللي هي سوت لي احتراق وظيفي أساساً. عشان كذي it doesn't matter. فبالنسبة حق اللي هو شنو الشفت اللي صار اللي خلوا جهات العمل more يعني aware with this problem. أنا أكلمك عن اللي هو وزارة الصحة إنزين بالكويت. الشفت إنزين كان اللي هو COVID-19. حتى الريسورسز اللي موجودة بالويب سايت مال الكويتي بورد إنزين only been added because of COVID-19. They realized how burnout is very serious and how common burnout became. Then the prevalence increased, يعني skyrocket. That's when they realized, okay, we need to do something about this. لأن a lot of doctors they quit. They actually quit. They moved to private. They stopped. They moved to their own country, to their home country. ففي وايد أشياء صارت. Then they made وزارة الصحة إن realize that maybe there is a problem and we need to fix it.
ممتاز، يعطيك العافية، مشكورة.
الله يعافيك.
أحمد عنده سؤال إذا تعطونا أكسس.
السلام عليكم، صوتي مسموع؟
Yes.
أوكي، أول شيء يعطيك العافية وايد دكتورة فجر. To start with, بس بقول إن I'm one of your admirers from far away. I see how you care about your patients and how you always خلينا نقول توقفين ضد أي ممارسات خاطئة تشوفينها من الدكاترة أو تشوفينها من المجتمع على بخصوص الطب أو الصحة النفسية بشكل عام. I admire that a lot in you والله.
Thank you very much.
You're welcome. دكتورة سؤالي هو هل في patients فعلا يجون to a psychiatry أو psychology department سواء بالمستشفى سواء خاص سواء كلينيك شنو ما كان بخصوص البرن اوت بالذات؟ لأن ما أدري إذا نظرة الناس لأن أنا تعبان هذا شيء لازم بس كذي أحله مع نفسي ويلا، ولا لا they realize إنه okay it is a mental health issue. يعني I don't know if they see it as a mental health issue to start with من الأساس. Do you see patients or clients, whatever the label is, complaining of burnout specifically?
No, usually it is some of them that come as, but usually حق psychology, not the psychiatry. They come with burnout and they want to change their career. They think they might be not a good fit حق الفيلد هذا. A lot of يعني some of them go to psychology, but not for psychiatry. Usually when patients go to psychiatry, they develop the consequences of burnout, which the ones that I mentioned basically. They got from burnout to depression, and then from depression to anxiety, and some of them substance abuse and all of these things. So that's when they come with the issues. So when they develop mental health issues, and that's what I meant by saying, even though burnout is not exactly a medical condition, or it's not a diagnosis, but it is very serious, and it is kind of like a continuum that can lead to medical and mental health issues. So we need to figure it out early, and we need to detect it early in order for us to like break this continuum. You know what I'm saying? I hope I answered.
Yes, you did. مشكورة ما قصري.
عندنا اثنين يبون يسألون، حساب الرابطة والأخت دلال.
Assalamu alaikum. Hey doctor, how are you doing? We just have a question here from the audience. It says, question for Dr. Fajer. How can I keep my mindset positive most of the time under pressure?
Can you repeat the question, sorry?
Yeah, it says, how can I keep my mindset positive most of the time under pressure?
Okay, so that's a very important question, because we're always under pressure, especially in this field. Okay, so there is no easy ride in medicine, even when you become a doctor, especially during the first few years after graduation. So that's a very good question. You have to keep taking breaks. You have to dissociate. It's very important. Once in your job, during clock, and then you have to be very engaged with the patient. You have to be empathetic, compassionate. You have to give them your all. But once the job is done, you have to unblock. You have to dissociate your work life and your personal life, or your school life and your personal life. I know it's hard. I know, especially since you're going to go back from work or from school, you're going to keep continuing studying, you're going to review some journals, so you're going to keep thinking about the patients and the stress that you're having, but you need to dissociate, especially even during exams. Okay, so I have an upcoming exams. I will study for this amount of period of time, and then the rest of the day I will unplug. So I will not finish studying and then مثلا I watch a movie ولا whatever وأفكر بالأسئلة اللي ممكن أعطيني. فهمتي؟ So you have to dissociate. Dissociation is very important. Another thing you should do to keep yourself in a positive mindset during stress is to be organized. That's first thing, is to be able to think ahead, to do a to-do list. It's actually very effective to do a to-do list. You want to do the things that needs to be done right now, and then things that can wait until the time comes. Second thing is, after being organized and after unplugging and dissociating between the work life and the private life, you need to give yourself a break. So this is very, very common. We don't give ourselves enough break. You deserve a break, whether it's after an exam, whether it's after a rotation, whether it's during the exam periods. You need to take a break, you can't take a break, and it's fine to take care of yourself. You can exercise, you can eat well, you can sleep well, but you need to take a break. And that's the only way you can be in a good mindset, in a positive mindset, even during stress. I hope I answered the question.
Thank you, doctor. I just have a question for myself. I'm just organizing the event here. But where do psychiatrists like yourself go when they're facing issues?
Where do
psychiatrists like you go when they're facing issues?
That's a very interesting question. Even in psychiatry board as residents, when we are psychiatrists and we usually the ones to take care of other people and take care of patients, it is very important that they are teaching us. What they're teaching us is you need to take care of yourself as well. Even if you're a psychiatrist, even if you're a psychologist, even if you're a mental health professional, you need to take care of yourself. If you're not feeling okay, then you're not feeling okay. You shouldn't come and see patients today. So what our program directors usually tell us, like I know this is my first year in the board, but what I've noticed, like in the younger generation with doctors, because they are very aware of the burnout and they're very aware of the effect of burnout, they usually make sure that we are okay along the way. So if we're not okay, we can talk to them. So you can talk to other colleagues. Just because you're a psychiatrist doesn't mean you shouldn't be able to discuss your mental health issues. Everyone has mental health issues. Everyone goes through a period where they need to ask someone for help, even if you're usually the one who provides help.
Thank you, doctor.
الأخ دلال عندها سؤال.
السلام عليكم، هل صوتي واضح؟
عليكم السلام، اي صوت واضح.
أول سؤال أنت بارتلي جاوبتي عليه هو كان سؤالي هل الطريقة الوحيدة لعلاج البيرن اوت هو taking a break، ولا هل ممكن إن الشخص يكمل شغل while treating their burnout؟
No, obviously, yes, sorry, continue.
الشغلة الثانية sometimes it's more a battle in the mind that you don't want to miss opportunities but at the same time you're in a burnout. So يعني هذه الشغلة الثانية اللي كنت أوضح عنها.
Can you repeat the second part because your voice got
النقطة الثانية إن sometimes there is a battle in your mind. You don't want to miss opportunities but at the same time you're burned out.
Yes. Okay. So regarding the first part, you always take a break when you're burned out. There is no use. يعني burned out زين بالضبط عارفين الشمعة المطفية اللي خلاص doesn't light up. You're basically that. It doesn't matter. يعني if you go to the, I'm really sorry about the reconstruction. If you go to the work and treat patients when you're burned out, أنت قاعد تسوين جريمة. Why? زين الجريمة هذه مو بس عليك أنت. لأن أنت يعني you're not okay. Then how are you able to take care of another human being? And you're gonna make life decisions when you treat patients, whether it's psychiatry, whether medicine, whatever field you're gonna go, you're gonna make life decisions. فأنت قاعد يعني you're not just affecting yourself, you're affecting patients. So it's always better to take a break, come back when you're in better mindset than to treat patients in that way. I hope I answered that.
Yes, thank you.
You're welcome.
الأخت فيرة.
يعطيك العافية دكتورة.
الله يعافيك.
كنت بسأل like are there stages of burnout? Like are there early symptoms that I can notice to prevent a fully developed burnout episode?
Yes, usually burnout starts out as إن أنت تكونين وايد يعني that's why it happens in the first years of graduation, which happens in medical school. لأن الشخص يكون وايد مشتاق وايد perfectionist, they want to give it their all. فهذا الوضع إنه يعني بس يبي يشتغل طول الوقت. He doesn't mind extra shift, he doesn't mind to work more than 24 hours in the hospital. فهذا الاشتغال الزايد مع perfectionism مع الأشياء هذه كلها هذه usually تعرفين إنه there is going to be a burnout at the end. When you're doing too much, even more than what you're required to do, when you're putting too much on your plate, you know you're going to have a burnout at the end. So it usually starts that way, and then you see yourself slowly losing energy, being fatigued, being drained. The job that you used to love and enjoy going to work every single day, you feel like, ما أبي أروح مرة ثانية خلاص. I don't want that. So it starts as overachiever. It starts as I'm putting too much on my plate. And then you slowly see yourself being drained. And then it takes a toll on your physical health, and then it takes a toll on your mental health. And then you reach to a very serious level of burnout, or a very late stage of burnout where you lose your passion, you lose your motivation, you lose your interest in the whole field itself. So be careful in in doing too much, because doing too much is very amazing thing, but you know at the end of the day you will be burned out.
Thank you.
You're welcome.
أخت لطيفة.
السلام عليكم، واضح صوتي؟
Yes. عليكم السلام.
يعطيك العافية دكتور for the informative presentation.
Thank you.
سؤالي أمانة لطلبة الطب أو إحنا عموماً اللي هني ندرس برا، وايد ربعنا they seek us as for help، وإحنا ناس للحين مو متخصصة يعني صدق ندرس psych, we know about like psychology، بس ما عندنا consultation.
Yes.
سؤالي كيف ممكن أساعد شخص خلينا نقول burnout red flags، يعني جايك وما يبي يروح مثلا professional يفضفض وعنده مثلا مشاكل، فكيف ممكن إني أنا أساعده؟
Okay. شلون تساعدين أحد burnout؟ Then this is the reason why we did the lecture. Because يعني we know إن not a lot of people زي مثلا يعني مو كل الناس راح يتخصصون psychiatry، مو كل الناس راح يكونوا mental health professional، بس لأن this topic is يعني as you can see by the surveys affecting a lot of يعني huge percentage of you guys, and then you need to know like it's maybe a colleague, it's maybe you then who is experiencing these symptoms. But the first thing that you can help her with doesn't have anything to do with psychiatry and psychology, is basically again taking time off, taking care of yourself. Basic things that you usually do is nutrition, good night's sleep, timing yourself or being organized helps a lot. Not leaving things to the last minute, not putting too much on your plate. Another thing that can help is exercising, if I didn't mention that already, meditation, especially mindfulness. Mindfulness is an amazing tool for burnout, and a lot of studies have supported its use for especially burned out patients. And it doesn't have to be, you don't have to be an expert in mindfulness to suggest it or even do it. As Dr. Ibrahim Zidi said, there are a lot of apps now that teaches you how to do mindfulness, tells you exactly how to do the steps of mindfulness and how to do the body scan and how to be present in the moment. So a lot of things can help. Other things that you can do for this colleague or yourself if you're experiencing burnout is self-reading, is to educate yourself about burnout, to read more about how to take care of your mental well-being, how to take care of yourself. Just like you're very careful in taking care of a patient, you should be very careful in taking care of yourself as well.
ما قال دكتور
yes.
بس دائما الناس اللي مهتمة بالسايك اوريدي يسمعون نفسهم يحضرون هالمحاضرات. أنا الحين حاضرتها، بس أغلب الناس ربعنا مثلا خلينا نقول اللي يشتكون أو يتخلطون وأنت تدرين إن فيهم مثلا burn out أو depression أو anxiety، للأسف don't know. فأنت كونك friend يعني هل بس تعطين النصائح أقولها مثلا sleep well يعني هل إن النصائح هي the only way to help a person passing through مثلا burnout أو anxiety أو whatever، أو في شيء ممكن مثلا أقدر أساعده أكثر؟
Okay, so it depends on the situation. Is it just being burned out ولا drained from work ولا الموضوع تطور وايد وصل لمرحلة depression ولا anxiety ولا أن عنده suicidal ideations contemplating committing suicide؟ يفرق وايد. إذا كان الموضوع very serious, he's reaching very late stages of burnout, and then you're noticing, and then he's gone beyond like the burnout العادي, he went into the complications of burnout. No, you don't just advise. You can advise, that's perfectly fine. But in this case, you should tell your patient, your friend, and refer him to a doctor or a psychologist or a psychiatrist. So you have to tell your friend, what you're experiencing are burnout, or what you're experiencing is actually like clinical depression, and that you need professional help. You know, if it's mild and moderate, okay, is that you can help. Obviously exercise, eating well, sleeping, everything that I mentioned can help. But if the situation is very serious, or you're not even sure like how serious the situation is or how far your friend has reached in the stages of burnout, no, you should tell him like, I am worried about you and I think you should ask for help.
Perfect, thank you very much, Dr.
هل في أسئلة ثانية ولا؟ الحقيقة دكتورة أنا عندي سؤال إذا تقول لي.
تفضل.
نعم فضلك. الحين البيرن اللي فهمته إنه ناتج عن overdoing stuff. متى يعرف الشخص إنه بس كافي إذا عديت خط يحوشني بيرن اوت؟
Again, can you repeat the question? Sorry, my سماعة مو واضحة عندي.
متى يوقف الشخص عند حده؟ أو متى يعرف إنه لا بس هذا حدي ما أقدر أتجاوز هالخط؟
What do you mean? Can you explain? Can you elaborate the question?
ما معناه؟ مثلا أنا كشخص أحس إن عندي القدرة على الإنتاجية بشكل كبير.
Okay.
لكن وصلت مرحلة اللي خلاص حاشني بيرن اوت وما أبي أسوي شيء. متى المفروض أنا كنت وقفت ما عديت؟
Okay, so when يعني your question is in when how to know my limits?
بالضبط.
Okay, so how to know your limits? Then أنت يعني شلون when you're doing, then when you're overachieving, and you're being a perfectionist, and you're being picky about every single thing, taking extra shifts in the hospital, whatever it is, you will feel drained. يعني you shouldn't. Okay, you should feel tired. You should feel exhausted after a long day of work or a long day of studying. But it shouldn't get to a point where you feel like there is nothing, literally nothing I can give more than this. If you go at the end of the day and before you go to sleep and you have this feeling like أنا ما عندي ولا أدنى ولا 1% زين طاقة إني أسوي أي شيء، مو بس بالشغل، مو بس بالدراسة، حتى بالبيت، ما لي خلق أكلم أمي، ما لي خلق أكلم أهلي، ما لي خلق آكل حتى، أو إني I watch my favorite TV show. I don't even have this energy. You know you reached your limits. فهني you need to tone it down. You need to do whatever you're expected to do. Best you need to know your limits and يعني not over stress yourself, which can be hard to do, especially in an environment, especially in like hospitals. They might push you so far that it can be it can be over your limits, you know, because they expect as medical student or medical doctor, which is very wrong. They expect you to know everything, to be available all the time, but that's not right. That shouldn't be the case. That is not healthy. Okay.
يعطيك العافية دكتورة.
يعطيك العافية دكتورة فجر، يعطيك العافية زميلي عبد العزيز الخالدي. مشكورين مرة ثانية حضورنا الكريم دكتورة فجر، مشكورة دكتور إبراهيم، دكتور بسام. صراحة يعني كلمة شكرا ما توفيكم، لأن ما نشوفكم بس أطباء، مثل ما أنت تو قلتي mental health professionals، يعني فيها شيء إكسترا عن إن أنت تكون طبيب. فيعطيكم العافية، استمتعنا بوجودكم وايد. نتمنى نقابلكم مرة ثانية، ونتمنى المقابلة الجاية تكون ان بيرسون قرلندا، تشرفونا. واستمتعنا وايد وياكم، يعطيكم الف عافية.
الله يعافيكم، مشكورين وايد على الدعوة.
الله يعافيك. حضورنا الكريم شكرا على الحضور، اتمنى انكم تكونون كنتوا استمتعتوا ويانا في الندوة هذه او المؤتمر، ويعطيكم الف عافية. نشوفكم على خير.